Hi, Mr. Lavender.
Yep.
I'm Amber. I'm a student with the University of Texas at Arlington. I'm going to be working with you today. Okay. I'm working under Dr. Martin, and I just want to let you know everything we talk about today is going to be confidential. Your information will not be shared with anyone.
Okay.
All right, so let's get started. Can you give me your full name?
James Ray Lavender.
Okay. And Mr. Lavender, how old are you?
31.
What was your date of birth?
June 21st, 1985.
Okay. So what brings you into the clinic today?
Frequent headaches.
Okay. And when did these headaches start?
About 2 weeks ago.
What were you doing when they started?
I was working out in the garden.
Okay. Where's the pain located at?
I guess it kind of is all over, I guess.
Is it worse in any one location?
I guess kind of behind the eyes, it feels a little bit worse.
Okay. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable, where would you rate your pain?
Probably about a 6.
Okay. Is there anything that makes the headache better?
Being in a dark room, laying down, and then I've been taking some Tylenol and ibuprofen.
Okay. How much Tylenol are you taking?
Two 500 milligram tablets, and then 4 hours alternate and take 800 ibuprofen.
Okay. So you're doing Tylenol and then 4 hours later ibuprofen and then back to Tylenol?
Uh-huh.
Okay, good. Is that helping with the headache?
Yes.
Okay. Is there anything that makes the headache worse?
Just bright lights, I guess.
Bright lights. Okay. Are you having any other symptoms with your headaches?
No.
So no blurry vision, no dizziness, no nausea, anything like that?
No.
Okay, that's good. We're just going to go through a little bit of your medical information, and then we'll get that headache taken care of, okay?
Okay.
Are you allergic to any medications?
Yes, a Z-Pack, I think.
What kind of reaction did you have to that?
I broke out in rashes.
Okay, what did they give you for that?
Nothing. They just swapped me and put me on a different medicine, and then it went away.
Went away. Okay. You never had to have an EpiPen or anything like that for it?
No.
Have you ever been hospitalized for a reaction to medication?
No.
Do you have any seasonal or environmental allergies?
I guess grasses, weeds, and trees are allergies.
Okay. What kind of allergic reaction do you have to those?
Just a runny nose.
Okay. Are you allergic to any foods?
No.
As a child, did you get all your vaccinations?
As far as I know, I did, yeah.
Okay. Did you get a flu vaccination this last year?
No.
What about a pneumonia vaccine?
No.
Okay. Do you know the last time you got tested for tuberculosis?
No.
No? Okay. When was your last physical with a doctor?
I guess July. I had a DOT physical.
Okay, good. Was everything normal with that physical?
Yeah, everything looked good, he said.
Okay, good. So let's talk a little bit about your past medical history. Have you had any childhood illnesses?
I had my tonsils out, I guess, when I was 5. And then in junior high, they diagnosed me with ITP. I guess it's low platelets.
Okay. What did they do for that?
They put me in the hospital. Whenever they first found it, I guess I was really low. And they put me in the hospital for a couple of days, gave me a couple different medicines, and boosted it, and then sent me home. And they monitored it for a while, and I was on a steroid pill, and then they just kind of quit monitoring it.
Okay. Do you know when the last time was that you had your platelet levels checked?
No, I don't remember.
Okay. And you don't take any medication for it now?
Correct.
Okay. Did you have any mental problems when you were a kid? Have they ever told you had ADD or anxiety, anything like that?
No.
Okay. So as an adult, have you had any illnesses, cancer, hypertension, a heart attack, anything like that?
No.
Okay, good. Have you ever been hospitalized besides for the ITP?
No.
Have you ever had any surgeries besides the tonsillectomy?
LASIK, I guess.
LASIK. So surgery for corrective vision?
Yes.
Okay. Have you ever had any injuries?
I broke my nose a couple times and a collarbone when I was a kid.
Okay. Have you ever had any disabilities that keep you from doing specific things at work?
No.
Okay. Have you ever been given a blood transfusion?
No.
Okay. So let's talk a little bit about your family. Tell me about your mom. Does she have any health problems?
A few, I think.
Okay. Do you happen to know what they are?
Something with her thyroid and then Addison's disease, I think.
Okay. Do you know if her thyroid is overactive or underactive?
No.
No. Okay, that's fine. How old is she?
61.
Okay. So what about your dad? How old is your dad?
62.
Okay. Does he have any health problems?
I think all that his problems are the same thing like that ITP. He was diagnosed with that a little bit before I was, or sometime in the same time frame, I believe.
Okay. Does he have to take any medications?
No.
No. Okay, good. Let's talk about your mom's parents. So your grandma on your mom's side, is she pretty healthy?
I think she was whenever she was alive. I don't think she had. Every now and then she said she had to take iron. I don't know what that was about.
Okay. All right. So what about your grandpa on that side?
He's not very healthy. He had several strokes before I was born, and then a couple more after I was born, and then knee replacements, and he used his body pretty hard.
Okay. Did he pass away?
Yes. I guess in his later stages he ended up with dementia and didn't know where he was at.
Well, I'm very sorry about that. Let's talk about your dad's parents. How about your dad's mom? Was she pretty healthy, or is she?
Yeah, all of them have passed away, but I think she, for the most part, was pretty healthy.
Okay, and what about his dad?
I think he was pretty healthy. I guess whenever he died, they were thinking that it might have been his gallbladder, but they never really found out. Don't really know what happened.
Okay, great. Do you have any brothers or sisters?
Younger brother.
Your brother? And how old's your younger brother?
25.
Okay. Is he pretty healthy?
Yeah, I think he got all the health and the eyes and everything.
Well, I guess you got the bad luck then.
Yeah.
Okay, so we're going to talk a little bit about your personal life, okay? Do you smoke?
No.
Do you drink?
Yes.
Okay. About how much do you drink?
Probably a drink every night after work.
Okay. Do you drink on the weekends?
Sometimes if we go out with friends, but not too often.
Not too often. So about just one a day.
Yeah.
Okay. Have you ever felt the need to cut down on your drinking?
No.
No? Okay. What about drugs? Have you ever taken any drugs?
No.
Okay. Have you ever been exposed to any harmful chemicals?
Probably at work.
Okay.
It's probably not a real healthy environment.
Okay. What do you do for work?
Pipeline technician for Enterprise Products.
Okay. So is that an oil field or?
Yeah, I guess oil and gas industry.
Yes. Okay. All right. So what do you do for hobbies?
Nothing. Watch kids.
Watch kids. All right. How many kids do you have?
3.
Oh, so you're busy.
Yes.
How old are your kids?
Almost 2 and almost 1.
Okay. So, and you have 3? So, do you have twins?
Yeah.
Okay. How old are the twins?
They're almost 2.
Oh, okay. So you are very busy. Do you have a wife or a significant other?
One.
Okay. And do y'all live in a house, an apartment?
House.
Okay. Any pets?
Yes, we have 3 dogs.
Wow. Well, that's awesome. Have you ever been in the military?
No.
Okay. So we're just going to do kind of a real quick review of all your body systems and just see if anything else is going on that may be accompanying the headaches.
Okay.
Do you feel like you have a pretty well-balanced diet?
Yeah, for the most part.
Or, okay. Have you ever had a like sudden increase or decrease in weight?
No.
No. Okay. So generally, you try and stay pretty healthy.
Yeah.
Okay. Have you ever had a sudden rash or itching with headaches?
No.
No. Any changes in skin color?
No.
Okay. With your headaches, do you have any vision changes?
No.
No. Do you have any dry eyes where you have to use eye drops?
No.
No. Any pain in your ears?
No.
Okay. What about drainage from your nose?
No.
No. Okay. Do you have frequent sore throats?
No.
Any seizures or loss of consciousness?
No.
Okay. We're going to talk about your lungs a little bit. Do you feel like you ever have any shortness of breath?
I'm just sitting here. If I run, yeah.
But normal day-to-day activity.
No.
No shortness of breath. Okay. For your heart, do you feel like you ever have chest pain?
No.
No. Do you feel like you have any swelling in your feet or your ankles throughout the day as the day's going on?
No.
Okay. And you've never had a heart attack or anything like that?
No.
Okay. Do you feel like certain foods affect your stomach more than others?
Probably, but I don't know what they are.
Oh, okay. Do you ever have any problems with going to the bathroom, like constipation?
No.
No. How often would you say that you have a bowel movement?
Probably almost once a day, if not once every other day or something.
Okay, good. So let's talk about the urinary system. Do you have any problems going to the bathroom?
No.
No. Any frequency or burning with urination?
No.
Okay. Have you ever had any sexually transmitted infections?
No.
Okay. Do you have any pain in your muscles or in your joints when you're walking?
No.
No stiffness in the neck or in your arms?
No.
Do you have any intolerance to exercise?
Intolerance of wanting to do exercise, but other than that, no.
No difficulty with like lifting weights or anything like that. Okay, good. So I know you said no seizures or anything like that with your neuro system. Do you ever lose consciousness and just not realize it until someone kind of wakes you up?
No.
No? Okay. We have little lymph nodes in our neck. Have you ever noticed any bumps or swelling or tenderness within your neck or the back of your head?
No.
Okay. Have you ever been told recently that you have anemia, or has that been checked recently?
No.
Have you ever been told you have any endocrine problems, such as thyroid, diabetes?
No.
Okay, and what about psychological problems? Is there any recent stress or anxiety in your life?
No.
No, anything that would be causing some depression?
No.
Okay, well, I think we covered everything that we need to cover, so let's see if we can get that headache taken care of, okay?
Okay.